Hello, Professor Hill and classmate. My name is Safur Zohari, family nurse practitioner. Today we had a patient, Mark J. He's 11 years old, born in 2013. He's, he's an American male, and he accompanied with his mom because of the coughing for 5 days and productive cough, and started to have light yellowish sputum. Uh, he has a nasal congestion, runny nose, and fatigue. Um, when I examine, when we just talk to Mark in the office, he seems alert and oriented and a smart kids. He's complaining of coughing for 5 days, getting worse at night time, and when he go to outside, is not consistent, is on and off, and it's getting better with the over-the-counter cough medicine, and um, um, in the cough medicine there's a antihistamine, and he feel better with the congestion. He has a mild fever, and when we check, it was like 99.1 Fahrenheit temperature, and uh, Tylenol is gonna help him for the fever, and the fever started like a 1 day ago. He doesn't have any chest pain or shortness of breath, and in past medical history, he doesn't have any significant problem. Um, just he had a flu in last 6 months ago. Uh, Surgical, just circumcision when he born. No allergy to medicine or food or environmental. And vaccination is update, and he got the flu shot on November. For social history, he's an middle school. He's in middle school, and he's doing good at the school. His grade is high, and he's living with his parent and one young sibling, and she is 9 years old. They're living in a new house, and Mark weight and height and milestone meet the requirement for his age, and yeah, he's doing after school sport 4 days per week. He's active and energetic. He's eating mostly at home, healthy food, and balance protein, vegetable, and fruit. Um, um, like a 2 time per week, he's eating outside, and he's trying to eat more nutritionist food. Um, their parent has insurance, and he has good access to medical field, and there is nobody smoking at home, and they're not drinking, just like as a social, and there is no illegal drug used at home or from his friend. He has a good sleep habit, and he sleep like 8 hours at night, and when he wake up he's fresh. He has no depression and no sign of anxiety. Family history: mother is healthy, his dad has the high cholesterol, and sister is healthy. Maternal grandma has diabetes, and grandpa, he passed away at age of 67 with heart attack. Generally, he's healthy, and his height, weight, and milestone is in normal range. He just have a mild fever and fatigue. Um, he doesn't complain from any system of his body, except he has a runny nose. He just reported the congestion, and sometimes he has light sore throat and coughing. Um, he feel he can hear the whizzing sound sometimes when he's breathing, but he doesn't report any shortness of breath or chest pain. He doesn't report any heart problem or any numbness, skin discoloration, and other system is normal. No allergy to medication, environmental and food. After we check the vital sign, every other vital sign was normal. Just temperature was 99.1, and in the office they checked the rapid strep test and it came negative. And we did the physical exam head to toe. He doesn't have any like a discharge from the eyes, blurry vision, no hearing loss or any discharge. From the nose, sorry, he has a clear runny nose and like inflammation. He has a runny nose and congestion. Turbinate seems like a pink reddish, and there is no lesion in the tongue, and tonsil was a little inflamed and red. A long sound check, and I could hear the whizzing sound in the inferior lobe, anterior of the chest, and no cracker or rhonchi heard. Just check the heart rate and heart sound. No palpitation. S1 and S2 was clear, no murmur heard, and no arrhythmia noticed. No numbness, and range of motion is normal, no edema noticed. All the lymph node checked, and he has a little like a tenderness in the lymph node in the neck, but it wasn't very large. And after all the physical exam we did, my diagnostic was like acute bronchitis. And acute bronchitis is like an inflammation in airway, and mostly they are viral infection. And when we have a viral infection, we don't use any antibiotic. And another differential diagnostic was like a streptococcus A, and we did the rapid strep, and it came negative. And the other thing for differential diagnostic could be like a pneumonia, and pneumonia can affect one or both sides of the lung, and we can diagnose by chest x-ray, physical exam, and to see if there is a pneumonia. But after we did the chest x-ray and physical exam, pneumonia was ruled out, and streptococcus A was ruled out too, and the main diagnosis was acute bronchitis. And for the plan for diagnosis, I'm gonna do the CBC to check for the infection. Chest X-ray is gonna be another diagnostic test, and physical exam as I did. For treatment, I'm gonna continue with the cough medicine and antihistamine as needed. And for fever, he's gonna take the Tylenol 4 to 6 hours, like 15 milli as needed. And nasal spray is gonna be used every 4 to 6 hours. For treatment, self-care is the mostly thing we can do. patient can rest at home and eat like a more uh, liquid and water, warm water, um, gonna help him or for the cough, and more protein like a chicken soup or vitamin C, zinc, and vitamin D is gonna make the like a length of the disease shorter. Uh, Nasal spray of normal saline is going to be continue, and I suggest to use the humidifier at night to just make the discharge just loosen. And education for this patient is going to be suggesting continue the medication. If he has shortness of breath or any problem, he need to go to ER or visit us soon. Thank you. Bye.